Until I'm 100% recovered and pain-free, I shouldn't even be thinking about returning to work, right? I don't even know if my employer will let me come back to work until I'm 100%. What should I do?
Great question. Studies have shown that being at work can often play a role in your recovery, and if you are able to gradually return to your work responsibilities, it can help you build your tolerance to increased activity. If you're still dealing with some pain or lingering effects of your injury or illness, talk to your healthcare provider, since having some discomfort may be expected, and your provider may offer ways to manage your symptoms. Are there short-term or long-term goals you can set and discuss with your doctor? Sometimes goal setting can feel overwhelming, but smaller goal planning can help make the process less intimidating. Find out what your company's return to work policy is by having a conversation with your supervisor or contact their human resource department. If your work is complex and difficult to describe to your doctor, you may want to ask your doctor for a conference call with you and your supervisor to discuss your job duties. This would be a good time to discuss your return to work plan, including restrictions and alternative ways to do your job if there are any. Beforehand, you may want to check out the Job Accommodation Network, JAN, at askjan.org to learn more ideas on accommodations in the workplace. I once worked with a client who was injured in a car accident which affected her ability to lift and to stand on her feet for a long period of time. Before her accident, she worked as a restaurant server, so those injuries made it impossible to perform her duties. She needed long-term rehabilitation with a physical therapist to possibly return to her job. She came up with a short-term goal of asking her employer if they would consider having her come back to work as a host, greeting the customers, managing the seating plan, and scheduling reservations. The restaurant's management did not want to lose her as an employee and agreed to the plan. Both are happy with the outcome. Is there a short-term or small goal you can set with your doctor or physical therapist? Progress often happens with many small achievements.